Hi, welcome to Empowered PT with Dr. E. Today I'm going to teach you a few exercises that you can do if you've been diagnosed with tennis elbow or lateral epicondyle tendinopathy. So very often with this condition, the radial nerve also gets very tense as a result of the tissues in that forearm tightening. So I always like to teach patients how to do a radial nerve glide, because very often this is going to help dramatically improve not only the symptoms of discomfort, but also improve the flexibility of the forearm extensors here. So to begin, what you're going to do is just bring the arm in a nice loose fist, okay? You can even tuck the thumb inside of that fist, but you just don't want to grip too tightly. So a loose fist slightly behind your hip and a little bit of extension. And then what you're going to do is you're going to bend the wrist back like this. And if you feel a lot of tension, it's fine to just stay here for 15 to 20 repetitions. If you don't feel enough of a stretch, then you're going to side bend your head away, bringing the ear toward the shoulder as you extend your wrist back. Okay, and that's just going to get the nerve sliding from the neck all the way down. So the goal is to do this for 15 to 20 repetitions, and unlike a stretch, you're not holding this. You're just going to work into a comfortable amount of tension and then work back out. Nice and fluid. Good. So after you've done 15 to 20 repetitions of that, the next thing I'm going to teach you is a static stretch to stretch your forearm extensors. So you're going to hold the arm straight out and you're going to be right in alignment with that shoulder. And then you're just gently pushing down on the fingers just until you feel a good stretch here at the top of the forearm. So once you feel that stretch, you're going to hold for 30 to 60 seconds. If you hold it for 30, just do 2 repetitions. You hold it for 60, 1 repetition is enough. And you want to make sure that you're just applying enough pressure that you feel tension, but not pain. If it's very painful, please back off and just don't push as hard through the fingers. Okay, so this is your forearm extensor stretch, and I would like you to do that after the nerve glide. Always start with the nerve glide to just help those tissues loosen up a little bit, get that nerve gliding and moving so that it can help to facilitate a little bit more movement in those muscles. So those 2 exercises you can do daily, twice a day. Then I'm going to show you a few strengthening exercises. So I recommend that you don't delve right into strengthening and overloading it with a weight until you're out of the acute phase of pain. So even if you just want to start the exercises without weight and progress to a weight as appropriate, that's fine. So ideally you would be sitting at a table with your arms supported here on the table and just your wrist off. But I'm going to lean forward just for the purpose of showing you the setup here. So your forearm will be supported on the table. You're going to grip a weight or start with no weight. And this is a 2-pound weight. You want to keep it pretty light, especially if you're still experiencing symptoms. And then you're going to lift the wrist up into extension. Hold a few seconds and then slowly control it all the way down. And notice I'm letting my hand hang forward so that I can work it into flexion too. So slow, controlled lift up, hold a couple seconds, and then control that descent down. So we're working the eccentric movement. Now, I'm also not over gripping, so I'm not squeezing the weight as hard as I can. Keep a nice loose grip. Yeah. And you can start with 15 to 20 repetitions of this exercise and work your way up to 3 sets of 10. So that's wrist extension. The other one is just flipping your grip. So now it's palm up. Now you're going to curl up into wrist flexion, hold a few seconds, and then slow, controlled lower down into wrist extension. Again, I'm not over gripping with those fingers. And same progression here, 15 to 20 repetitions and working your way up to 3 sets of 10 as appropriate. Okay. This next one is called the Tyler exercise. So if my right hand is the one that's impacted, I'm gonna hold this TheraBar, which is weighted. I'm gonna hold that with the affected hand and keep that elbow locked in by my side. Then I'm gonna take my unaffected hand, thumb side down, and I'm gonna kind of invert it, grab onto that bar, and I'm gonna twist the bar this way toward the camera. Then I'm going to extend out in front, and then I'm gonna slowly bend that right wrist down. And I bring it back in and repeat it. So it's twist, extend, and then slow, controlled release of that affected wrist. So it's working eccentrically. Slow, controlled release. Good. And same point for this exercise. You're starting with 15 or so, working your way up to 3 sets of 10 per your tolerance. The strengthening exercises, I recommend doing those 3 to 4 times a week. You really don't want to do those every single day. And keep in mind that it's important to use pain as your guide. So if any of these exercises are making your symptoms worse, please back off of the resistance. You can do the movements first, and then work your way up slowly to a 1 pound weight, a 2 pound weight, etc. And if you're very sore after performing exercises, you can always utilize ice for 15 to 20 minutes, just wrapped right around that elbow. That can be very helpful, just decreasing some of the soreness after activity. Okay, I hope that you found this video helpful. And please refer back to it just to make sure that you are performing these exercises with good form. Thank you so much for spending time with me today. I look forward to seeing you next time. Bye-bye.